presentation is titled The Cancer Survivor and Insomnia and Why Can't I Sleep? So hopefully we can help answer that today. So we're going to go over just a few of our objectives, or actually some key takeaways from the presentation today. So we want to help define insomnia and the importance of restorative sleep, as well as understanding ways in which insomnia, give me 1 second, that's better. Some ways in which insomnia can interfere with health, function, mood, and our quality of life. We're going to review the recommended therapies for managing and treating insomnia, and we're also going to have some discussion, and we're going to discuss the importance of communicating well with your physician or healthcare provider about insomnia and how it is impacting your life. Okay, 1 second, Rox. I'm just trying to advance, and that's not allowing me to do that. Let's see. No. Next.
Staci?
Yes.
At the bottom, can you use your arrows?
No, that's what it's not allowing me to do, actually.
Okay. And if you're clicking on next, it's not going?
Let's see. There we go. Let's see, did I miss one? Nope. All right, perfect. So adults should get 7 to 9 hours of quality sleep each night. And by quality, we mean that this is sleep that includes falling asleep easily, staying asleep, and having restful, uninterrupted sleep, which is key there. And after cancer treatment, some sleep problems can persist, possibly due to long-term treatment side effects, medications or hormones that you're taking, stress or mental health, and maybe some poor sleep habits that developed while you were undergoing treatment, and just these habits are hard to change at this time. So what we know is that sleep improves your mood. So obviously, if we don't get enough sleep, that's happened to all of us from time to time, and we get a little cranky. It helps us with our ability to cope with stress, increase concentration, improve memory, our ability to solve problems with fewer mistakes. It actually helps your body rest, and it renews and repairs your body, which is so important. Improves the immune system, which lowers your risk of becoming ill and helps to fight infection. Again, this is so important, especially during this time with COVID. Increasing energy, so you feel less tired and experience less sleepiness during the day, and you're able to participate in your everyday activities and things that are important to you. Sleep helps to regulate appetite. It lowers our blood sugar level. It can also help to decrease your risk of diabetes and obesity. So sleep disorders are conditions that affect the way you sleep and your overall quality of life. So sleep deprivation can increase your risk for other health problems as well. The physical and emotional effects of having cancer and going through cancer treatment can create some long-term challenges for survivors, including these sleep disorders. And during some surveys, survivors have listed sleep as one of the most important issues that they are concerned about for their health and well-being. So we're going to take a minute to talk about some of the common sleep and wake disorders. So there are about 80 different types. We're certainly not going to talk about all of those today, but we're going to talk about a few of the more common ones. We'll start with the circadian rhythm of sleep disorder. And basically that's like a mismatch between your sleep and wake cycles, your day and night cycles. So often too, if we can think of maybe a baby, or if you had, when you had a baby, that the baby sometimes was awake at night and sleeping during the day. So the circadian rhythm gets a little confused. So some of the possible causes could be routinely sleeping during the day, shift work, travel. maybe insufficient sleep syndrome, which is a chronic lack of sleep due to some of the unhealthy sleep habits. And then narcolepsy, which is actually a neurological disorder. So that affects your brain's control and the sleep center and the wakeness. And it's usually characterized by extreme sleepiness during the day or falling asleep suddenly. So this is a bit more than just being fatigued from not having a good night's sleep. This is something, again, controlled by the brain, where you could be possibly speaking with someone and they just fall asleep suddenly. And then restless leg syndrome, which is actually a sleep disorder. So it's really an urge and an uncomfortable sensation in your legs. And it usually happens at night when you're in bed. And then you just feel like you have to move your legs constantly. And it really can cause some issues with sleep. We're also going to talk about sleep apnea, which is a common sleep disorder. So basically, it's interruption during sleep. And there are two main types of sleep apnea. So the first, or the most common, is obstructive sleep apnea. And that's when the muscles in the airway actually are weak and they become blocked. So oftentimes you can present with snoring or possibly gasping for air. And then obviously trouble concentrating and daytime fatigue, they can all be results of sleep apnea. And sometimes that can be caused by obesity, smoking, asthma, and that chronic nasal congestion can also contribute to sleep apnea. So patients sometimes are prescribed CPAP for that. And you may know someone that has a CPAP machine. And basically what that does is it just keeps continuous, like a light continuous air pressure that reminds your body to kind of to breathe while you're sleeping, and it kind of keeps those weak muscles open. And then there's central sleep apnea, where the airway is not blocked, but your brain forgets to tell your body that it's time to breathe. And sometimes this happens after a head injury or neurological injury or possibly some neurological diseases. Then we have hypersomnia, which is sleepiness during the day, and this is despite getting enough sleep. So again, the causes could be untreated sleep apnea, narcolepsy, or some of the neurological disorders. So what our presentation today is focused on is insomnia. So the definition of insomnia is trouble falling asleep or staying asleep at night. And it is the most common sleep disorder. So how do we diagnose sleep disorders? So we'll talk a little about that. And it's possible to have more than one sleep disorder, which is not a great thing. So one can actually cause the other. So having sleep apnea, that also contributes to insomnia. So according to the Sleep Foundation, there's no definitive test for insomnia, but there are a variety of different tools that we can use to measure and help diagnose these symptoms. Some of the diagnostic tests for other sleep problems, you may be referred to like a sleep specialist or a sleep disorder clinic. But for uncomplicated, mild to moderate insomnia, it's usually manageable, and we can usually treat that without having you see a specialist. And just a little review again of helping to diagnose different sleep disorders. So if you're sent to a sleep specialist, they sort of review all your symptoms and they may order some of these studies to help further diagnose. So a sleep study or polysomnogram, PSG, that's a test that evaluates the oxygen levels, your body movements, and your brain waves. And this kind of all works together to help determine why you're unable to sleep soundly or why you're getting disrupted during the night. And oftentimes, these sleep studies can be done at home, which is really good news for people that don't want to go somewhere and spend the night. And part of that, as we said, was an electrocephalogram or an EEG, part of the polysomnogram that assesses the actual brain activity. There are other studies that help diagnose narcolepsy, which again we talked about, was a disease usually caused in the brain. And it's a daytime napping study that they use to help diagnose this narcolepsy, and it's used in conjunction with the polysomnogram. So let's start talking about insomnia because that's really what we're here for. So simply stated, insomnia is just having trouble sleeping. It is, again, the most common sleep disorder in the general population. So about 30% of people either have insomnia or have experienced it at some time. And in our cancer patients and population and survivors, this can be up to 75%, which is a really high number. So the risk of it increases with age, and the risk can increase with any illness such as cancer. So again, that's why our numbers are so high. So insomnia can occur despite having enough time to sleep. So you're going to bed, you have that maybe 7 to 9 hours that we talked about is so important, but once you get in bed, you have difficulty falling asleep, you have difficulty staying asleep. You may wake up often during the night. Um, Maybe to use the bathroom. You may wake up too early in the morning and then can't get back to sleep. And then obviously the next day you're feeling physically and mentally tired. So we're going to break down insomnia a little further and talk about some of the different types of insomnia. So there's a primary, which we cannot directly link to any medical or psychiatric illness or problem. There is secondary, which what most insomnia is, and that's a symptom or side effect of another problem or health condition. So if you're asthmatic, have cancer, maybe some underlying depression, pain from arthritis, sleep apnea, all of these are considered secondary. It could also be caused by medications that you're taking, maybe some new lifestyle changes or substance abuse. There is acute insomnia, which lasts less than 3 months. So this one's often caused by stress, anxiety, depression, again, lifestyle changes, or any acute medical condition. And then there's chronic, which is a long-term trouble sleeping at least 3 nights a week for greater than 3 months. So again, this could be part of an underlying physical or mental health disorder. It could be due to medications, possibly a sleeping partner who may have sleep apnea or snoring, or another sleep disorder that needs to be diagnosed and you need to see a specialist for. So secondary insomnia, as we talked about, is the most common. And why? Like, why do some of us have this secondary insomnia? It could be, again, due to stress, any life changes, including the death of a loved one, a job change, a divorce. You could be undergoing some emotional distress, again, anxiety, depression, PTSD, maybe an acute illness. So GERD is just gastroesophageal reflux, so acid or heartburn that sometimes happens when you lay down. It could be sleep apnea, where you're not getting that sleep that you need because your body is waking up frequently to breathe. And hyperthyroidism can cause some anxiety that leads to sleeplessness. Any kind of physical discomfort like pain, if you're getting up frequently to urinate, if you have hot flashes, again, gastric reflux, or that restless leg syndrome that we talked about earlier in the presentation. And then your environment, your bedroom, where you sleep. Is it too hot? Is it too cold? Is there light that's keeping you awake? Is there noise either internally or externally in the home that's causing you to be awake? So these are all things that need to be considered. And again, for secondary, maybe it's medications. Are you now taking some hormonal therapy? Steroids will definitely keep you awake. Antidepressants can do that. Some blood pressure and heart medications may also do that. Any other substances? So oftentimes we've heard people think that alcohol can help them sleep because they feel relaxed. And although that is true, alcohol is a depressant, so it does affect our central nervous system. It can slow down our brain activity. It can cause decreased responsiveness. But unfortunately, when consumed in excess, it can actually do the opposite. It can cause poor sleep quality, and it can be dangerous for people that have sleep apnea because then again, it can actually suppress that sleep, and when they're trying to breathe, it can help with interfere with that blockage and the air that they need. So Caffeine, again, can be a stimulant, and any illicit drug. So a scheduled interference can also cause some of the secondary insomnia, possibly jet lag, which we would hope would be short term. Any kind of shift work or change in a regular routine, possibly traveling, can do that as well. So specifically now for insomnia in our cancer survivors and patients, this can definitely be related to a cancer diagnosis or any time during the cancer trajectory or experience, from the time of being diagnosed through staging. These are all very stressful times. The treatment itself and the side effects from treatment can cause insomnia, and through survivorship, when you're just getting back to your new normal and trying to overcome some of these things from treatment, these can all still be contributing to the insomnia. It's really a combination of physical and psychosocial factors. It includes anxiety, worry, fatigue, pain. Um, and although it's a common problem, patients don't often discuss these symptoms of not sleeping with their physician or healthcare provider. So possibly some of the reasons why they're not discussed, patients may think it's a normal response to their cancer diagnosis and treatment, that maybe they think they're not supposed to sleep, and maybe they feel like it's not important as some of their other health issues to discuss that with the physician. Or possibly the healthcare provider just hasn't asked or made it a priority. So again, if this is an issue, it should be addressed in the same way as any other health concern. And we have to understand that the cause of insomnia sometimes helps your healthcare team find the best way to treat it. So we always have to find what that underlying cause is, because that really may be the reason why you're not sleeping. So most of the time it's going to begin with you keeping a sleep history or a journal, and we'll talk about that. So these are some of the things that the provider or physician will ask you when you're explaining to them some difficulty sleeping. So have you had insomnia previously to your cancer diagnosis? Because then that can kind of help us with a different place where to start. And what are some normal sleep habits? So when do you go to sleep? How long do you sleep? How long does it take you to fall asleep? How many times do you wake up at night, and why do you wake up? And really importantly, how do you feel when you get up? They'll probably ask you to provide some details about your sleep environment. Again, your room, is it light? Is it dark? Is it noisy? Do you snore? Possibly, do you have a partner that snores? Are you aware of a changing breathing pattern when you sleep? And do you exercise? How often are you exercising? How long are you exercising? And what time of day? So we want to make sure that it's not too close to when you go to sleep at night, because oftentimes when we exercise, we do have these endorphins that give us that extra energy, and possibly that could be related to the insomnia. Do you have daytime sleepiness, and do you nap? If so, when and for how long? Are you sleeping during the day? Are we getting our days and nights mixed up? And your psychological history in terms of anxiety, depression, or is there some worry about recurrence of disease? So for sleep history, again, physical changes or symptoms, any pain, shortness of breath, hot flashes, frequent urination, any recent weight changes, what medications are you taking? Are any of them new? And what medications have you used to help with sleep? Any over-the-counter meds, any alternative therapies that you're trying, alcohol and caffeine. Are you drinking possibly coffee later in the evening? And this is the sleep diary that we talked about. So we want to recommend that at least for 2 weeks that you keep a diary to identify some of these patterns and trends. And that can be really helpful in possibly you recognizing some patterns, or maybe for your healthcare provider to help recognize. So our goal is definitely to improve our sleep quality, which is really going to improve our overall quality of life. So the management may begin by simply treating any of the underlying causes like pain, depression, anxiety, hot flashes, again, all the things we discussed, maybe even some shortness of breath or a cough that's keeping you awake at night. But we may also want to include some of these behavioral or cognitive changes that we need to identify first. So there's several cognitive and behavioral techniques that might be helpful. We'll talk a little bit about each one. We'll start with cognitive restructuring and then some behavioral strategies that maybe help control your sleep, or is there something that's restricting your sleep? What can we do to help you relax? And some basic sleep hygiene education. So many of these are used to help optimize the sleep quality and again, improve your fatigue and activity during the day. So cognitive behavioral therapy will start with cognitive restructuring. Recognize and change thoughts and behaviors that cause or worsen your sleep problem. So if there's anything that you can sort of identify, are you worried when you can't sleep now that when you go to bed that's going to be a real issue for you, and then that sometimes increases the risk of you being awake? Stimulus control therapy. So reassociate your bed or bedroom with sleep and develop a consistent sleep-wake schedule. So it's really good to have a routine. Try to keep that routine the same in terms of what time you go to bed. But if you're in bed and you can't sleep after maybe 20 minutes, then possibly get out of bed, and then so you can associate your bed really for just sleeping and intimacy, not to read, watch TV, eat, or even like work on your computer in bed, because then you're not really associating that with sleep. Some other therapy that might be helpful is sleep restriction. So maybe reducing the time spent in bed to kind of deprive your body a little more so that you feel sleepier the next night. So this tries to really prevent you from lying in bed when you're awake. Again, relaxation, to relax and calm your mind and body, kind of relieve your muscles, your tension, and your stress. Maybe it will help control some pain, lower your blood pressure. These things are usually helpful with meditation, will help with that. Breathing, it kind of slows your breathing and heart rate. Guided imagery, thinking about something pleasant. Muscle relaxation, Tai Chi, and yoga. And I think there's several apps out now that I've seen advertised that can kind of help with lots of these things and kind of help your body relax before you go to bed. Another one could be remaining awake, which we call paradoxical intentions. So you kind of reduce that anxiety about falling asleep. So you, instead of that, you intentionally try to stay awake. So you're not really worrying about not sleeping. You kind of let go of that worry, and it kind of helps you relax and fall asleep a little better. And then biofeedback mechanism really is observing and learning to adjust your biological signs, such as your heart rate, breathing, and muscle tension. So possibly if you are stressed about falling asleep when you get in bed and you notice that your heart's kind of beating a little fast, if you could just kind of take some deep breaths and kind of take notice of that, maybe that would be a pattern that you identify when you're keeping your journal. And sleep hygiene is so important. And some people actually just may not know what that term really means. And sleep hygiene is just healthy sleep habits that can help with some mild to moderate insomnia. So when we talk about sleep hygiene, that's what we're speaking of, these healthy habits. So the goal is to possibly change your current health practices and habits and environmental factors that can interfere with sleep, and we may not even be aware of it. So again, sleep and wake at regular times. So if you can possibly try to keep on a routine, keep your body on that sleep-wake routine, create a dark and comfortable environment, again, quiet, keep your bed for sleep and intimacy only. You want to relax before bedtime, maybe try a warm bath, some calm music, avoid watching TV or anything on TV that might be upsetting. Avoid working in your room with your computer or your phone, because that kind of tricks your body into thinking it's daytime because of the light from that. So if possible, we want to turn those off 1 to 2 hours before sleeping. Again, consider a noise machine or any kind of relaxation tape that might help get your body in the getting ready for sleep. Some people do well with earplugs or a sleep mask. And get enough daylight during the day, during your non-sleep hours. Consider even using artificial light if you're someone in the wintertime who maybe needs that extra light to help with that. If you do nap during the day, we want to try to limit that to about 30 minutes. And try not to sleep after 3 p.m. because that again may affect how tired you are before bed. And this is something that a lot of us have issues with, drinking fluids before bedtime. So if we can try to cut that out by maybe even 6 o'clock, that would hopefully limit our trips to the bathroom. We have talked a little bit about alcohol. So we want to try to avoid drinking that possibly 4 to 6 hours before bed because, as discussed, it might help you initially fall asleep, but it can interfere with your sleep during the night. Nicotine and caffeine, again, are stimulants that can help interfere with sleep, likely to interfere. And we've probably heard this before. Some people suggest drinking some more milk before bed. It's the protein in that that might be helpful, and turkey has, I think it's tryptophan, I've heard before, that can help with sleep. Get some regular exercise, but no closer than 3 hours. So exercise can definitely help with sleep, but again, we don't want to do it too close to bedtime. And keeping that sleep diary and recording your sleep and wake times might be something that we can see a pattern and that might be helpful for you or your provider. We'll talk a little bit more about exercise because maybe if you're not exercising enough, this can be helpful. It can decrease fatigue, it can help with your physical fitness and your mood, can help with stress, anxiety, depression. Exercise can definitely lower risk of cancer recurrence and it can help improve insomnia. So you could start slow by just walking 20 minutes a day for 4 times a week. That alone can help improve your sleep quality. But it might take a little while. So I would say to do that, and maybe within a few weeks, you would start to see a difference. It can help you have a more restful sleep when you exercise. It can increase the time you spend in deep sleep, which is the most restorative phase. And it can help improve the duration of sleep so you feel more tired and ready to go to bed at the end of the day. And we did talk a little bit about avoiding it closer than 3 hours before bedtime if possible, and to help avoid over-exercising just because you don't want to possibly have a pulled muscle or have pain that can actually lead to that insomnia. So medications are considered if cognitive behavioral interventions haven't helped, we do try to use that as a last resort, and we do only recommend them for a short period of time, possibly up to a month. But also if there are some other health issues that need to be addressed, such as hot flashes, pain, anxiety, and depression, then possibly we would use those medications to help instead of possibly a sleep medication. But the kind of medication that we use will depend on the sleep problem. Either is it trouble falling asleep or trouble staying asleep, or is it related to other medications you're taking? And we also have to take into consideration what other medications you're taking before we decide which sleeping pill might be right. And so with that, we'll talk a little bit about medications. So all medications, as we know, have potential side effects. Most of the ones used to treat insomnia can be habit forming. And so that's why we like to say we would like to limit that to a short course of treatment if possible. And they can cause rebound insomnia if stopped abruptly. So it's something that we may have to wean off of. We should not mix any medications for sleep with alcohol because that can increase the sedative effect of that. And we still have to take caution with our over-the-counter sleep aids. So again, always discuss with your provider or physician before starting any medication, including maybe those ones that are over-the-counter or any kind of herbal or botanical treatments. So medications for insomnia, they haven't been well studied specifically in the cancer population, but they are widely used anyway. But they're based on studies and evidence from patients with primary insomnia and from clinical experience from prescribing over the years. Antihistamines are probably the first line that you may have tried if you've tried an over-the-counter sleep aid, because it is usually the primary ingredient. So Benadryl or diphenhydramine is usually in something like Tylenol PM, Advil PM, and Unisom too. And so actually the sleepiness from an antihistamine is the side effect of that, but it's not really recommended by the FDA for sleep. It just happens to be a side effect of that drug that works well and may help you sleep. Some of the other medications that are commonly prescribed are like non-benzodiazepines or hypnotics, and most commonly used are Sonata, Ambien, long-acting Ambien, or Lunesta. So some of these may sound familiar. Benzodiazepines, usually used for anxiety, but they can also help with sleep. Xanax, Ativan, Klonopin, Restoril. Then we have another group that are your tricyclic antidepressants like Elavil, Tofranol, or Pamelor. Second generation antidepressants, Trazodone or Remeron. Then we have some other drugs as well, antipsychotics like Seroquel or Thorazine, and then your chloral derivatives like chloral hydrate. So most of these medications have been prescribed for sleep. But also, some of you may be either taking these or know somebody that's taking these. So when we go over the little list of side effects here, I don't want to frighten anyone, but I just want everybody to be aware that, again, all medications do have side effects. And many people can tolerate this group of drugs without the side effects, but we just have to make sure that we know that it's possible. And also just a little disclaimer that the side effects I have listed here are not by any means an inclusive list for these drugs. But as we know that they can cause sedation, we want to try to avoid any concomitant use with opioids or pain medication, because that can increase the sedation, the central nervous system depression, and unfortunately even death. The meds are listed above are usually for high risk for addiction, as we discussed. Some of them can cause some suicidal thoughts or behaviors. Most can cause anticholinergic effects, which basically means dry mouth, constipation, blurred vision, and sometimes urinary retention, difficulty urinating. And in our elderly population, it can cause an increased risk of dementia. So again, not to frighten, but just to let you know it's possible. And again, to discuss with your physician any of the side effects you might be having. We'll talk a little bit about some of the natural and botanical supplements that are out there. So melatonin, many of you may have heard of that. It's a hormone that's actually found naturally in the body. It does help regulate those sleep and wake cycles. And it also may help when using drugs to help alter the normal melatonin production. So if you're on beta blockers or benzodiazepine, these may actually help with that as well. No significant side effects, or not usually any hangover that you might sort of get with some of the other sleep aids, including Benadryl or diphenhydramine. I've heard people say that they felt like they were very sleepy or have like a sleep hangover the next day. No withdrawal symptoms. But the thing about melatonin that's good to know is that it takes a while to work. So if you're taking melatonin, don't be expecting it to work right away. I would say probably anywhere from 2 to 4 weeks before you would actually see it working well. And then it does come in different doses. So possibly you need to maybe increase the dose after a couple weeks of not having any luck with that. And then there is cannabis or cannabinoids, CBD. So a little limited data on sleep. It's generally well tolerated. There's some kind of mixed reviews out there if it can help. We know that it helps with chronic pain. We know it can help with appetite and nausea. but there is some concern again for abuse and dependence as well as sedation. But again, if you're discussing with your physician, then that would be fine. Chamomile tea, so it's been around for a while as a botanical supplement. It's considered safe. And actually, there was a study out though that showed that that it did help with sleep quality. Sorry about that. And then a couple others that I have not heard about until the presentation were kava kava and valerian root. So I'm not sure if anyone has heard of those, but kava kava is actually from the evergreen shrub in the Pacific Islands. And valerian root, the origin it's a natural herb from Asia and Europe. So kava can act like kind of like alcohol in the brain, where it can induce a little calmness and relaxation and may help relieve some sleeplessness initially. And valerian may improve relaxation and reduce anxiety and help with falling asleep. But some clinical trials have shown these products may not improve actually the total sleep time or quality when they compared it to placebo. And again, with a lot of our natural and botanical supplements, they're not regulated by the FDA. So we still have to be careful when mixing them with other medications. So again, it's always important to kind of discuss that with your primary care provider. All right, sorry, I got a little issue again where we're not going forward or backward. There we go. Okay. So we'll talk a little bit more about insomnia in terms of cancer treatment and potential. So again, it's unique, just like the type of cancer and treatment to every individual. Insomnia is very common and it's a chronic problem for survivors that can affect overall health and quality of life. We want to inform your healthcare provider if you're experiencing insomnia so they can help you manage it. But first, it's really important to identify any underlying health issues. So that might be contributing to the insomnia. And the sleep hygiene or habits that we discussed, some recommendations that could lead to some improved health practices and routines that might overall help with insomnia. So some therapies like cognitive therapies can help with relaxation, basic sleep hygiene education, and maybe just a little counseling or speaking with someone about some issues, some underlying stressors that might just be helpful that we haven't recognized. That sleep diary can really help us recognize those kinds of things too. Pharmacologic interventions or medications might be needed for short term, and they may be used in combination with other non-drug therapies, like maybe combination of um, yoga or meditation when you first start some of these medications for sleep, and then with the thoughts that we could wean you off of the medication, and then you would still have these good sleep habits in place. And the persistence of insomnia in survivors kind of underscores the importance of having good communication with your healthcare team, because we want to make sure that all of these things are being discussed. So actually, what I'd like to do now, if everybody sort of has like a pen, or if they could get like a pen and paper, we're going to do a short quiz, like a short little survey, not really a quiz, but a survey on some of your sleep habits. So we'll just wait just a few minutes. We'll take a survey to see if we can sort of rate where you're having your insomnia. Is it mild, moderate, or severe? So I'll just give you a few minutes to grab that and we'll go on.
While everybody's grabbing their pens and piece of paper, if you have any questions, please feel free to put them in the chat and we'll have Staci answer them towards the end.
All right, I think that's probably good. Let's read those together and get started. So let me just explain. So it's a little insomnia self-test that we actually obtained from a VA website, myhealth.veterans.gov. So it's really kind of short. And I want you to circle the answer or write down the number. Let's put it this way. Let's write down the number next to the answer that best describes how you feel. So difficulty falling asleep. So if you have no difficulty, you would write a 0. If you have mild difficulty, a 1, moderate 2, severe 3. Or if you think falling asleep is a very severe issue for you, that would be a 4. So basically 0 to 4, you're going to rate how difficult it is for you to fall asleep. And then number 2, difficulty staying asleep. So the same thing, 0 to 4. How difficult is it for you to stay asleep? 0, 1, 2, 3, or 4 is very severe. Problems waking up too early. Do you find yourself sort of lying in bed and not being able to go back to sleep very early in the morning? Much earlier than you'd like to wake up. So 0 if you have no problems with that, up to 4 if you have severe problems with that. And then number 4, how satisfied or dissatisfied are you with your current sleep pattern? So it's a little opposite this time. Like if you're very satisfied, okay, that's great, that's 0. Moderately satisfied, 1, satisfied, 2, dissatisfied, or very dissatisfied, 4. Again, 0 to 4. And just a few more. So number 5, how noticeable to others do you think your sleep problem is in terms of your quality of life? So do you think others can tell that you're having difficulty sleeping? 0, not at all. 1, a little. 2, somewhat. 3, much. 4, very much. And number 6, how worried or distressed are you about your current sleep problem? Is this something that is very distressful for you pretty much on a daily basis? So if you're not worried or distressed about it at all, it's a 0, a little bit of 1, 2, somewhat, 3, much, 4, very much. And then the last one, number 7. So to what extent do you consider your sleep problem to interfere with your daily function? So your mood, your concentration, your work, your chores, your memory, pretty much your overall quality of life. So to what extent does this sleep problem interfere with your daily life? 0, not at all. 1, a little. 2, somewhat. 3, much. 4, very much. Okay. So that's it, 7 questions. Now we're going to try to score that. What I want you to do is add up the score to all 7 questions. If you scored 0 to 7, then no clinically significant insomnia, so that's really a good thing. So 8 to 14, so again, mild, so that's good too. So I would say in some of these mild categories, mild to moderate, we could probably start with some of the cognitive behavioral therapies and definitely do our sleep journal. So if it's 15 to 21, then we're talking about some moderate severity. Let's start with the sleep journal, maybe starting with some over-the-counter things or maybe some melatonin. And then 22 to 28, again, clinical insomnia sounds severe. So something that definitely you need to discuss with your healthcare provider. But again, start with that sleep journal so that when you get to your healthcare provider, you have some information that they're going to want to ask you. So what are some of the first steps? Review your medical history, make an appointment, obviously, make an appointment with the healthcare provider, review your medical history, medications, do a complete physical exam, treat any underlying causes we talked about, like pain, depression, anxiety, if we can pinpoint those, the hot flashes, start that sleep diary. Consider initiating some of the sleep hygiene recommendations we discussed, relaxing, routine, dark environment, moderate exercise during the day. Pretty much it. So, Roxanne, do we have questions?
Well, we do have one, and you did touch on it earlier.
Okay.
There was a question that talked about you recommending taking melatonin, or is there a situation where patients shouldn't take melatonin?
So, pretty much melatonin is safe, and it is safe with other medications the other prescription medications that you may be taking. I would say if you have concerns, if you're taking something else or if it would be harmful, you could definitely discuss that with your primary care provider. But melatonin has been known to be safe. We do recommend that first line for patients that are on current treatment or have issues or concerns about sleep. We usually start there. And again, you have to give it a little time, like we talked about, that 2 to 4 weeks, and see if it's working for you. I would say also add in some of those sleep hygiene recommendations and see where you are. But generally, melatonin is a safe medication and a safe starting point.
All right. I just have another question for you.
Sure.
Is Remeron safe to take every night? And is Arimidex known to cause sleeping issues?
So Arimidex, yes, let's start there first. Arimidex can cause sleeping issues. Um, so in terms of Remeron, Remeron again can help with sleep. We also use it for different things in oncology. We use it to help with appetite and things like that. But a side effect of it again is sleepiness, so that's why we give it at night. But typically, if patients are already on treatment, then I would say yes, that's something that must have been prescribed for them, the Remeron, and it can be safe to take. But just so they know, also, like I talked about, we usually also prescribe it for helping with appetite and the side effect is sleepiness. That's why they take it at night. And Arimidex can, yes, cause sleep disturbances. So I'm not sure. Sometimes when you change the time of the day, so for Arimidex, you should take it the same time every day. But sometimes if patients have other issues with it, you can either start taking it at night if you're taking it in the morning and see if that works. So sometimes just a simple change in the schedule, instead of taking it every morning, you can take it every night. Let's see if that's helpful. If not, definitely talk to your prescribing oncologist about the Arimidex, and it would be safe to take melatonin with that as well.
And can ARBs like valsartan cause problems?
Yes, so ARBs, some of the other medications too for blood pressure and for heart can also cause some difficulty sleeping. My other point to that would be, how long have patients been on these medications? So again, if it's something that you've just started and you're noticing problems with sleep, then I would say more likely yes. But if it's something that you've been on for a longer period of time and your insomnia not quite so long, then probably not. So again, the timing of everything is kind of important to see which happened first. Did you start taking the medication first, or did you start having issues with sleep first? So that's why it's important to kind of keep that sleep journal for 2 weeks so we can kind of get a better understanding of when things are starting and occurring.
Okay. The Valerian root and the kava kava,
Uh-huh.
Are they safe compared to melatonin when you're taking other medicines like aromasin or an aromatase inhibitor?
So generally speaking, melatonin is a little safer than the others. Again, none of the medications are FDA approved. There's been actually more research, I would say, with melatonin, and it's known to have little to no side effects, whereas kava kava and valerian root can have side effects. I think it's the valerian root I found that can also cause some issues with the liver. So I would say if I had to choose between the two, melatonin would be a first choice.
And melatonin, is that habit forming?
No, it's not habit forming.
Okay. Um,
That's something that you can stop at any time if you feel like it's not working for you.
okay. Do we have any other questions? Anybody want to ask a question of Staci while we have her? Well, Staci, I want to thank you again. And who's that cute little fellow?
So that's just a little picture. It's not my puppy, but it's just a little picture I found that to kind of hope that everybody can rest as well as this little puppy. And I hope that this was helpful. I want to thank our survivorship program director, Roxanne, our coordinator, I should say. Thank you for your time and for your expert IT work here. And also, I want to thank Susan Hunter, who's our survivorship navigator, for all of her help and her work on the slide presentation as well. And thanks to all of you for joining us today.